Hello, class. Now, today we're going to start with chapter 11 policies upon health. What sort of policies do we have in our society, in our country, that impacts people positively or negatively when it comes to dealing with their health? So, we're trying to try as best as possible to understand what social policies we have in place and how this policy making and how these social policies have been made. It's because most of the time is for every issue in this country, there is some form of policy. If you go into the archives or you look at certain things, but the key thing is how are they made? Who are the policy going to benefit? And who are those that are not going to benefit from it? In fact, not only not benefit, but it's going to harm certain segments of the population. As we can see, there has been series of policies being made. So making the policy is one. How is it going to be implemented is another. Who is going to implement the policy? And if the policy requires resources, is there going to be any? Because right now we have, okay, there is no discrimination, no hate. You have all these hate crimes and this, in the books. But what happens every now and then we see them in various ways. And some people, just by the way, the loopholes in the policies renders some of those policies irrelevant for some people. Yeah, there are no, in terms of the government, there's no policy that says you hate somebody or you discriminate against somebody. That was then. But now, policies are you respect everybody, black, white, whatever groups. But unfortunately, the way it's been implemented becomes the challenge. You have some policies that not so much against different lifestyles or gay marriage or races, but the way these things are implemented always gives rise to people not being sure what is really being addressed. And people at times take the law into their hands, especially when it becomes dealing with whites, dealing with other minorities. And just as what people have been going through this past year, dealing with social issues, how different races interact with different with each other. The police, in particular, how do they interact with blacks, black men in particular? it has been a real challenging emotionally and in all aspects, you know. It has been a traumatizing effect. It has created a traumatizing effect on minority population. And now there are certain situations wherein people take upon themselves to to um, to hurt people from China because of misunderstanding that have been given to them by certain groups in dealing with the COVID virus. Even though there are social policies that no group should hurt each other, but again, how are some of these policies really being interpreted? When people feel that they can do that, they can harm other groups that are different. And this is going to become a real challenging aspect, because as the country becomes more diverse and we have so many outlets of people talking about the fear of the other, it becomes much more easy for people to take arms or do whatever they can do to inflict harm to the other groups. So our social policies have to be clearly specific and the responsibility for each one of us to make sure that we respect each other, respect the differences, accept the differences as an advantage for the country, not as a disadvantage. Because usually right now, minority groups feel very much unsafe. They are worried about their safety. Even to go to public places, they are worried. Who knows who might, you know? And especially with the amount of guns out there, people are now even becoming almost concerned to go to their workplace because of what could happen. Somebody could look at them and said, oh, he is not one of us, and therefore he or she should be taken away, be shot. So the social policies we have in place dealing with guns, who should be able to have a gun, how those things should be monitored. It's not that, okay, people should not have guns. No, this is not the idea. The intent is who should be able to have a gun. Because some of us are fragile. Some of us might be having other issues. People killing themselves and killing others. But if there was no gun involved, things like that will not happen. So maybe those are, again, some of the social policies that we have to make. Great, the Second Amendment. But people who have guns should also be responsible, use those guns in a responsible manner. Because if not, others are going to be hurt. And also, people are also imposing their own values on others. When it comes to sexuality issues, again, those that are in the minority usually experiences poor health as a result of that, psychologically and physically. It contributes to a lot of destructive behavior when people are looked down upon. Behavior such as excessive drinking, excessive eating, or just something to just pacify them, which later on can lead to just some very, very negative health outcomes. So our social policies should be sure that everybody is equally protected. The government should develop policies that protect everybody, respect everybody. And in most cases, people don't have to agree, but respect the difference. Because the world will not be as interesting as it is if everybody sings kumbaya, but sing kumbaya with respect for the other person. Because again, if you go into the constitution, how men are created, certain rights, right to pursue happiness. So these are things that are very important. The right to pursue liberty, freedom, happiness. And rather than creating policies with so many loopholes that gives a kind of wink and nod, the kind of approach to one group to harass other groups. And also the legal system also has to be really for all, not for the one that can provide the best lawyers, the best lawyers who can talk people, convince people from showing them blue, but telling them is white because they are good at it. The truth. The truth should be at the bottom of all that we do. If we're going to really continue to make policies that are going to help people. Because policies are there to address issues, to address concerns for certain groups or for other groups. But once those policies are put in place, they should be respected fully. Because again, those social policies that are made influence people in a variety of ways. As I said, they can infect them physically, socially, financially, and leads to behaviors that could be very destructive. And also contribute to educational opportunities. See, because when there are certain policies that makes it difficult to attend certain quality schools, you are from day one almost set to fail. The type of school you attend, if you everything being normal, if you don't have the appropriate resources, the appropriate teachers, the appropriate physical conditions of the buildings, you have a uphill to really succeed. Yeah, some people do manage to come out of those conditions and still succeed, but it's much harder. It's much more difficult. So the policies that are made should also be supported by the resources to make sure that those policies succeed. Let's don't say, okay, we create all school age kids should go to school. Great. But what policies do we have in place to make sure that the school they go to is well equipped? And the school age child also is properly equipped to go to school to learn. Are they coming from homes that are health friendly? By that I mean, what sort of homes are they coming from? Is it a turbulent home? Are they coming to school prepared to learn? Are they well fed? Or are they in class thinking about, Lord, I don't know where my next food is going to come, my next meal is going to come from? Or what is going to be happening at home tonight when I go home? Because again, some of those policies are created because starting from where people live, what employment opportunities that they have, what sort of educational opportunities do they have? Are they employed? Are their parents employed? Or are they underemployed? You have unemployment, underemployed, and fully employed. Most of the time, you have minorities. In most cases, are either unemployed or underemployed. Wherein, even though they are employed, but they don't have what it takes to really meet with their demands, the demand of their families and their own personal demands in terms of rent, healthcare services. Unlike those that are fully employed, in most cases, they can be financially equipped to be taking care of their family demands, their health needs, and other, be able to also live in good housing conditions. You see, most of the time when people are unemployed or underemployed, they live in sub-housing situations. wherein conditions are not as good. Health conditions are not. At times they live in crowded communities. They live in situations wherein things are just not there. So at times, as we continue to discuss health-related issues, we have to really be able to listen to each other. First of all, we have to start from the premise that we are all equal in God's eyes. Black, white, brown, whatever a social identity or designation that people have. And therefore, whatever policy is made, it should be appropriately directed to addressing whatever issue that we are trying to address for all. Because most of the time, see, America is right now, we are faced with the situation, paying for those situations of past policies that encouraged or past policies that has increased the wealth gap, the haves and the have-nots, or policies that have also increased the injustice between groups or the injustices between groups. So now, whatever happened is enough to get people to the edge. So some of those policies should be revisited and addressed appropriately so that they benefit everybody equally, so that we can all live in peace. And we have to, as we develop some of those policies, most of the time we deal with the socioeconomics on the haves and the have not. Most of the time, a good number of those policies that have been developed, unfortunately, have benefited some of those. Because even when you start talking about the welfare system and whatnot, you'll find out most people who have benefited for some of those, it's not so much for those people that the policy was intended for. The other group have benefited from it. And therefore, we really need to be much more intentional. The policies have to be much more intentional. If this is one to resolve by developing these policies, be intentional about it and make sure the implementation of that policy is directly to the issue that you want to resolve and not a kind of a window dressing. Some of those policies are also cultural, and some have also contributed to environmental conditions. where people live, who live where. Say because where people live, your physical environmental condition play has a lot of impact in your overall well-being. If you live in slums or you live in an environment that is not as healthy, your overall health experience won't be that great. So policy is it's almost at the root cause of a lot of things. And my concern, this is my personal opinion, is some of these conditions are known by policymakers, but they all committed to really addressing these conditions. Because some of these conditions, in terms of housing, in terms of schools, school systems, in terms of social interaction, how people relate to one another, those are all in the books. And they've been in the books for quite some time. But we still relive some of those issues. We still relive some of those issues. So maybe we have to revisit those issues and really become much more intentional in implementing those social policies. So that we can live in a society wherein everybody is treated with respect, with dignity, and given equal chance to succeed. I said, because at the end of the day, when people have equal chance to succeed, now they have the opportunity to do. If they want to succeed, they know what they need to do to succeed. And because when it's when we don't get to that level, we always create problems down the road. And we can go back and say, oh, the policy is there with this, but still the issue. See, I always have the issue of, say you have a recurring problem. You go to the doctor and the doctor gives you medicine. You feel kind of slightly better. 2, 3 weeks, 3 months, you come back with the same problem. Maybe that doctor might do something better than just diagnosing the symptom. That doctor needs to really go after the root cause of that symptom. Because giving you medication to feel better for 2, 3 days, 2, 3 weeks, or 3 months, then coming back, they say that really does not help. You go to the root cause. Some of this root cause of some of these problems is this racist attitudes. We might not want to hear it. But do we really believe when we say we are all Americans and all Americans have equal rights, benefits, equal liberty, equal opportunity to pursue happiness. Do we really believe it? Or we just saying it? And do we really believe that, at least as Americans, we have access to the resources, or equal access to the resources that America produces? See, we still have these are old age questions. There are certain times we think those questions have been answered. But as with a lot of things, the answer is still incomplete. The implementation is incomplete. We have to find ways to address some of these things. America is blessed enough. There is no country in the world that is as blessed as America in terms of resources, in terms of talent. Even they talk about the climate, the climatic conditions, blessed enough. Most of the time, our challenge is, are we really all committed to making sure that we treat each other with dignity and respect? And most of the time, there lies the problem. And what is social policy? Social policy can be described as a field of activity decided upon and implemented by the government, a course of action, and indeed a web of decisions rather than a single decision. Policy usually is a stance towards a particular topic and involves a cluster of related decisions and actions, often dealt with in a consistent fashion. Social policy is often concerned with tackling social problems and bring about change. The policy making process in which policy paths are determined is also complex and dynamic, itself subject to a range of influences from various groups and stakeholders who have an interest in directing policy. See, there comes the issue. Those people who direct policy, it's a who most of the time, who are the people who make policy? See, up to recently have been mainly white. And the lobbyists, those people who lobby for this have been mainly white. And as the saying goes, if you are not at the table, you become the menu. See, even though some of these policies are marked for certain blacks and certain minorities, but most of the time, by the time you start with one big goal, by the time the policy is really done, most of the time is either the statistical is just, things are not changed. They might even remain the same, even though there might be some new wordings and this, but at the end of the day, is you face with the same problems. Certain times things do move. So these are all things that has to be taken into consideration. The policies are things to keep things as they are. Most of the time, social policies, when people work, that most of the time the policies, yeah, keep things as they are to give privilege or advantage to certain groups, or instead to try to treat people equally, to promote equity, equality, or alternative to extend inequality, to promote certain specific values or accommodate a range of diverse values, to change individuals or to change the environment. You see, these are all, it's not that people are really not working on some of those things, but at times it's a challenge. Blackmore and Griggs define health policy in two ways: as the effort made by the government to improve health through both services and medical treatment, as any activity undertaken by the government that affects health and illness. They argue that the wider social and environmental influences on what happens to us and to the US in the doctors and surgery or hospital are reflected in government policies. Again, there are certain policies that the doctor have in place because of the sort of system that we have. There are certain policies that doctors have to adhere to, and some of them are to the advantage of the patient. But most of the time also, as in some cases, depending on what sort of insurance do people have. Unfortunately, can determine to a certain extent what sort of quality of service that patient receives. Models of policy making. You have the rationalist. Makers have a good understanding of the problem and make clear, rational decisions. You are the rationalist. You have the incrementalist. Policy making makers do not start with a blank sheet. They respond to issues and make small and incremental changes. Then you have the pluralist. Policy is understood to emerge from interaction of different parties at all stages of development and implementation. Then you have the institutionalism. Policy is created by government institutions and implemented by them. Policy committees. Policy is made within specific committees via networks such as those that exist between the public and the private sector. So there are various models, and all of these models are appropriate for certain type of policies. But most of the time they can be used in various ways. Now, stages of policy making process. The three key stages described by Harrison are the public policy agenda. How and why do issues come onto the agenda? You see, because most of the time policy people just, it's how did it comes from the bottom, from the everyday, from the community. From there, it comes to the local community, and from the local community comes to the legislative body, and the legislative body deliberates upon those policies, and they decide whether to make it a policy or not. Alternatives and choices. Are policy choices rational? Is it the rational? Is it from really based on fact, or most of the time it was based on people's own opinion or their own figments of their imagination? Is it real? Is it a real concern? If it's a real concern, then it has to be treated as something that needs to be given that support to make sure that either it's a group or a state or whatever has that concern, there is a way a policy should be developed so that people living in that state or that community should adhere to that policy. Because policy is a form of type of law. You don't follow the policy, then you have to pay for the consequence for not following the policy. Implementation. Are choices put into action? And if so, how so? See, for me, most of the time is policies that we have a lot of policies in the books. I think the limitations of those policies is how they are implemented. Are they implemented across the board? Or are there some loopholes for certain groups? Because most of those social issues that we are dealing with today, there are policies for almost all of them. But the problem lies in their implementation. Is everybody really committed to adhering to those policies? Okay, so stop for here. Stop here today so that we can continue the next time with health is political. Our next lesson will be we start with health as being a political concept.